let's talk about for the patient out there. Let's give them some practical application.
Okay.
You mentioned the stellar patient experience, and a lot of that starts before you go into a practice. So what would be the top 5 questions you could think of off the top of your head they should ask over the phone?
You ask these questions and they will know that you are not just the everyday ordinary patient. So first question I would ask is, if I am going to have this procedure done, whatever it is, who is the clinician? Who's actually going to do the work? I want to know who that is. Then if they have multiple clinicians, it's like who, okay? And if there's multiple to choose from, then I want to know what my choices are. Question number 2, what has their education been and where did they get specific implant training? And for me, I want names of the places where they train. Now, the team's probably going to go, I have no idea. I'll have to get back to you. So yeah, I want to know where they trained. Is this some kind of weekend course they took?
Right.
Or have they been through hours and hours and hours at an accredited implant institute that teaches the proper way to do these things? So not just have they, but where did they train? How many hours of training have they had? And then next, how many actual procedures have they done? For how long?
Great point.
Right? So how many patients, how many procedures, if it's an implant related, how many units of implants, okay? How many implants have they actually placed in the last year and in the last 5 years, 10 years? Because with experience comes wisdom. The more I've done, then the more I have drawn, the more likely I am to be successful.
Yep.
Then the last question, and this is very, very specific, is how do they actually place the implant?
No, that's a great question.
And this gets into more specific clinical things, but do they use a surgical guide to place the implant? So today, and I'm not the clinician, and you have more people that will describe this in more detail, but today, with all the CAD/CAM technology that we have, an implant can be placed with precision, with no margin of error. So with a surgical guide, it can be done. I could place it, I can't, but a surgical guide adds to the predictability of the procedure. So that's the last question I would ask is, does the clinician use a surgical guide to place implants? So those are 5 things. There'd be more, but those would be my top 5. Now they will know when you ask those questions, they will know that you are a very educated patient. Yeah. And rightfully so. That sets you apart and you will get top priority because they know you're coming in and you're educated and you know what you're looking for.
It's a great point. It empowers you before you walk through the door.